you again. So, if a mother has done a glucose tolerance test in the pregnancy, okay, the GDOD test, okay, we indicate on the neonatal database. So we will say, if the GTT is normal, it means so we say GTT N or normal, that means that the glucose tolerance test was taken by the patient, and the mother is not diabetic. She's able to tolerate. If the test is abnormal, we will indicate. So depending on whether or not the patient is on treatment. So if it says on the form GDOD, that means the mother has gestational diabetes, but is only on diet control.
Diet control, yes.
Diet control. So that is GDOD.
GDOD, yes.
GDOD.
Yes.
That's what we write.
Yes.
If the mother is a true diabetic, meaning perhaps she was diabetic even before she became pregnant, and she is on insulin or oral treatment, we indicate. So we will say TDOI or TD on medication. That means before the gestation, the parent was diabetic and was on treatment, and she's either taking insulin or taking oral medication. If the patient is then gestational diabetes, on medication, we also indicate. So we will say GDOI, meaning she's on insulin, or we will indicate that she's oral antihyperglycemic. But we do indicate. If the patient has not taken the test at all,
not
then
taking
we
the test
say
at all.
no GTT.
No GGT.
And if the patient, sometimes you will find when you go into the mother's records that the mother has only done a random glucose test and a postprandial glucose test. Again, that patient we take as no GTT because in theory, the patient has not been challenged with glucose, so the glucose tolerance test has not done. So again, we do not know whether or not the mother is diabetic or not. So either way, though, we do indicate on the form so that you are aware what sort of channel to follow.
You have to follow.
Do you understand me?
Yes, I get it. Thank you and appreciate your cooperation.
Okay, who am I speaking to?
I'm Dr. Ali.
Okay, hi.
Thank you.
Pleasure.
Bye.